Scientists in Geneva broke into applause as 124 nations reached a new pandemic agreement. But will this sense of unity actually last when another crisis arrives?
Today's date is May 24th, 2025. Just 4 days ago, the World Health Organization made history. Member states officially adopted the first ever pandemic agreement, something that took over 3 years of negotiations, all set in motion by the aftermath of COVID-19.
It happened during the 78th World Health Assembly. What stands out is the voting: 124 countries in favor, no objections, and 11 abstentions. Not a single country voted against.
That's a rare example of global alignment. But just to be clear, is the agreement in force right now?
Not quite. This isn't the end point. The next major task is negotiating an annex, the Pathogen Access and Benefit Sharing System, or PABS. That annex will be drafted by a working group, then reviewed at the 2026 Assembly.
So, even after adoption, there's a process ahead. What exactly needs to happen before this agreement is actually global?
It needs to be ratified by 60 countries. That depends on how fast national parliaments act, and on the political will behind it. Until then, it's not legally in effect.
Let's pause and look at what's actually inside the agreement. What is its main goal?
The main aim is to close the gaps that COVID-19 exposed. The agreement sets out principles and tools for pandemic prevention, surveillance, and response. It also covers basics like routine immunization, building up research capacity, sharing technology, mobilizing the workforce, financial support mechanisms, and making health systems more resilient.
One thing that's come up is the One Health approach. That's the idea of linking human, animal, and environmental health, right?
Yes, exactly. The agreement recognizes that diseases cross borders and even species. It also establishes the PABS system, which is meant to ensure that benefits like vaccines and treatments aren't limited to wealthy countries.
There's been some debate about sovereignty. Does this agreement actually let the WHO tell countries what to do?
No, it doesn't. Article 24, paragraph 2 spells it out. WHO can't impose laws or policies on countries. That means they can't order travel bans, vaccine mandates, or lockdowns. National autonomy was a big issue during negotiations.
And on equity, how is the agreement trying to make sure that lower-income countries get access this time?
That's where the PAB system comes in. It sets rules for sharing samples and distributing things like vaccines, tests, and treatments more fairly. There's also a global supply chain network, funding, and a push to transfer technology and build skills in a range of regions.
We all saw how unequal access was during COVID-19. Does the agreement specifically address those failures?
That's the idea. The agreement is designed to avoid the delays and shortages that hit lower-income countries hardest last time.
But implementing all this sounds complicated. Are there concrete deadlines for countries, or are these just recommendations?
After the PABS Annex is finalized, which should be in 2026, countries can start signing and ratifying. There's a real sense of urgency, but no hard enforcement. It's about collective commitment and peer pressure, really.
So the real test will come when there's another threat on the horizon. If countries actually stick to what they've signed.
Right. This agreement is more of a framework. What matters is what countries do next, not just the signatures on a page.
So, to recap, the world's first pandemic agreement is now adopted. It's got broad support, but there's still a lot to do. The goal is to fix the gaps in preparedness, protect national decision-making, and make sure everyone can access life-saving tools in a crisis.
The world came together for this milestone. Now the real challenge is keeping that unity as we move from agreement to action.
Thanks for joining us as we broke down what could mark the start of a new phase in global health security.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it now for free.